Thank you, Thilak and Vasanta, chairperson sirs. Although in a lighter vein, the best way to empower internists at this 12:15 is to provide them with lunch. But somehow, on the professional and intellectual empowering, I will use this next 30 minutes to give you some inputs on this field. Now, this picture tells a lot of things. Why did I select this picture as the first slide? The empowering of internist or any professional for that matter is not an individual act. It's a collective process. And there are many who are involved in it: peers, seniors, the community, and so on. So we'll start with this picture. Empowering, whether it is professional or an internist, it's a collective process. It is more of a human resource management subject. I doubt whether I am the best person to talk to it, but I will try my best to deliver the best. So in the next 30 minutes, I will try to define the word empowerment in the context of internists. And somebody might ask this question as well. And internists are specialists in internal medicine. They have obtained postgraduate qualifications, fellowships, and so on and so forth. Why empower them more? So that is something that is worth asking. And what are the different ways of empowering professionals, for our matter, internists? So there are different pathways. And how we have done this in Sri Lanka and in the overseas so far. What can we learn from them? Always it is better to learn from someone else when you have models to follow. And what is the way forward? Because we, the College of Internal Medicine, being so young, even though we are old, we have a way forward in this process. So the word empowerment has many meanings to many. And somebody can say, especially the human resource management specialist, HRM sector, it is something to do with attitude. Because by the time you become a professional, you have already gathered your knowledge and skills, at least the basic, necessary to carry out your profession, mostly. So what you need to gather after that, it's the attitudes which will change your and your client's behavior. And if you remember the talk of our chief guest, I haven't seen him slide before, I only saw it that day, inauguration day. In the teaching process, the three things: knowledge, skills, and he put, rather than the attitude, the behaviors. Attitudes and behaviors more or less the same, I would say. So when it comes to the undergraduate level or the student level, it is the knowledge and skills that matter most. But we here, the professionals, what matter most, I would say, is the attitudes and the changing your behavior in order to change the clientele's behavior. We need to change the patient's behavior, the community behavior, the policymakers' behavior. There's a lot. Our behavior will matter to a lot. True that we had to gain knowledge and master the skills that we have gathered during our undergraduate and postgraduate days anymore, but changing behaviors, attitudes, getting more confidence, positive improvement, motivate our juniors, career coach and peace. There are a lot in this word attitude, empowerment. So if you check the Sinhalese word for empowerment, it's a balaganvima, right? The present participle is the empowering. So in the general context, It is just giving the authority, someone the authority or power. But in the context of professionals or internists, make them stronger, more confident in controlling their life, both professionally and personally, and claiming their rights as well. So claiming the rights is important. Every human being, we have a human rights. When it comes to professional, we have the professional rights as well. We have gone through this process for more than half or 2/3 of our lifetime now, right? So we have rights as a result of having gone through that difficult periods in our life. So it is important for us to define empowerment in our context, make them stronger, more confident in controlling their life, professional and personal, and claiming their rights. So this is the little modified definition I gathered from a human resource management site. So the question somebody might ask, why empower internists more? When the college was set up also same we had, why have another college? They have one thing already, why have it? They have gone through the O-levels, A-levels, undergraduate, postgraduate, they have got board certification, why another college? Some important question somebody might ask, often asked in many times. So I think this slide will answer some of that question. Now you can say there's a brain drain and there's a high exodus of doctors, but even up to now, we are facing a doctor's excess. You might not agree with me because this was not made with this economic crisis and exodus in place. But this is in 2017. Number of doctors in the Ministry of Health, 17,000. I think it has exceeded 20,000 now. Specialists in Ministry of Health, 2,000. I think it has come to about nearly 3,000 now. Number of medical doctors, university system, 625. I think it is close to 1,000 now. So this is the situation with regard to, and with the forecast, there's a doctor's excess in 2026. Of course, with the little bit of influence from here and there, we can always extend that. No, we need more doctors in this and that site, and we can increase the cadre vacancies and make it a turn. But truth is that we are feeling the excess of doctors and excess of specialists in the hospitals and the healthcare institute, aren't we? I'm not talking about the private sector. I'm not talking about the profession at large. There's excess. There's going to be in some fields. Yes. So when there's excess of any professional, what matters? Increase in number always lead to competition. So competition among the doctors can be either healthy or unhealthy. We must always look for a healthy competition. That is why we need to talk about this empowering in order to face a healthy competition. We don't want to have any clashes with our fellow specialists, or what you call it, the finer specialist or subspecialist or whatever you call it. But we need to have a healthy competition. We have to empower ourselves the way we can. Because we need it to better provision of care, and we always like to strive for excellence. It's a basic human need, basic human attribute. Because from the day one we entered school, everybody wants to get higher marks, get it a better position, aiming at that class prize, aiming at the distinction. So striving for excellence it's something that geared the human race, Homo sapiens, up to what we are now. If we didn't have that quality, we wouldn't be still Homo Neanderthal, or even before that. So luckily, the striving for excellence has driven us, and it will drive us further. And at times, it can be fighting for survival also. Because when the going gets tough, it is the toughs who get going, who had the additional, whatever the behavior, additional plus point, that X factor. It's like another superstar show. Final 8 are almost equal, but somebody will get in plan. Not that he is superior, but that X factor helped him. So you need to grow that X factor when you are fighting for survival. And in terms of clients also, if you really are interested in providing better care, it is convenient because when there are more numbers, that is why government look at it, that the other professions will look at it. More numbers, better. Okay, we don't have to wait till 10 o'clock in the night until that particular doctor comes because there is somebody who is there throughout the day now. Somebody might not like it, but he's there. So that is what people like. Okay. So the answer to the question, why empower them anymore? To face a healthier competition, not an unhealthy competition, not to have clashes, not to have any battles. This is a professional field, this is not a battlefield. So we need to empower our specialty to face them with confidence. So what are the different ways of empowering us, ourselves? I think the basic thing, the most important thing is a lifelong learning. Once you become a specialist, people think that I have got all these postgraduate qualifications, not many, but some. And beyond that, the learning comes very passive way. What you hear only, they don't really get involved in lifelong learning. I will get into that in detail little more. And the lifelong learning in the professional setting is given this name, continuous professional development. Because professional development is not only learning. Professional development is changing behaviors, getting more change in their attitudes, teamwork, facing stardom, yes. Because doctors are stars, specialists are stars. And when you are a star, in one particular town, when you go as the only physician or only internist to a place where internists have never been, or a businessman, the politician, the service care personnel, all will approach you. It's the truth. But you need to handle that stardom well. Unless you handle that stardom, you get spoiled. I'm not talking what happened in Australia with a star, but you need to know how the star, once you become a star, how you handle yourself. That is also important to master and behavior change. And the good old word for this CPD is a CME, so it's more or less the same. But as I say, it's not an education, it is something changing attitudes, learning behaviors, everything. And also we get professional accreditation. Even after MD, why do you get fellowships in the college from locally and overseas? Why do some few get accredited as in a one particular skill, accredited as a densitometrist, accredited as a nurse, diabetes educator, accredited as a podiatrist? It's worth. Because then only you can claim. You can't say, I am seeing 150 patients with diabetes a week, so I am the diabetologist here. No, I am not referring to me. You have to get accredited. Then only the society and the others will get in that. So we'll come to that also. These are the ways that you can think about getting yourself empowered. So the lifelong learning in the internist context allows them to stay current in the recent advances in their chosen field. Why did I say chosen field? For a special purpose. Because you can't get updated in the whole of general medicine or internal medicine. If you are trying to do that, I will tell you, you are not going to get anything. So once you become an internist, you have to have chosen field, at least 1 or 2 or 3, depending on your capacity. Right? We know that USA, even after their accreditation as a specialist, some specialize in 2 or 3. There are so many. In Australia it happens. And the UK it happens. But here it happens unofficially, but still we are trying to make it happen as a college. To choose a field one or two to specialize further, not to be a specialist, not to have a competition with our fellow, whatever, endocrinologist or anybody, so that it is good for us and good for the progression of science. So that will also enhance their research interest, because medicine is a more very rapidly changing, rapidly advancing. And other than the field of IT, I would say medicine is the second. IT, I would say first. I mean, IT is advancing at a rate nobody has thought about it. But medicine is a little behind, in my personal opinion. But we are only second to medicine, our change of practices, innovations. So this is why we need to engage. So lifelong learning is an attitude. It's an attitude. It's an attribute. And you have to grow it. You have to master it. There are no books to say. There are some books, of course, the life coaching books. And if you read Daniel Goleman's 7 Habits of Most Successful People, or 8th Habit, or there are maybe life coaches. But recently I went through one of them. Don't pay for it, learn how to get yourself better. Don't pay to learn how to get yourself better. You got it? Don't pay. Because you can't get it like a commodity in a book, in a short course. Even though they do it for their benefit and their popularity, you can pursue their books, but don't pay for them. That's advice. I get it from somewhere, but I thought it's a reasonable advice, because those books and the courses are very expensive. If you have bought the 7 Habits of Most Successful, somebody has gifted it to me, so I didn't buy it, but it's quite expensive. That is how they have become the bestsellers and they have become the rich people. Daniel Goleman is one of the very rich people now, right? So the benefits of lifelong learning nurtures curious minds. You have to maintain the curiosity in your mind as you get older. Keeps you up with the constant changing world. I told you, constantly changing medicine builds new skills. Now we, as after getting specialized, we build a lot of skills now. Even teamwork is a skill. Leadership is a skill. Facing stardom is a skill or attitude. Opens minds and increases the wisdom. And the wisdom is not something that you can get from reading a book alone. Wisdom is a long-standing attribute you get after many years of being with people, being in a profession, having gone through so many hardships. And they have realized people have gone through hardships, get more wisdom. They have analyzed. If you have gone through some of these TED Talks, the two most important things in the most successful people are the grit they have gone through and the resilience they had during the hardship they have faced. So grit and resilience. So don't get upset for working in a very remote place with minimal facilities. If you have the resilience to do that, we have seen so many who have got the opportunity to work in very remote places have resilient. They have built up all these places, and they have, true that when you are leaving, you are handing over to somebody, but you have got a good skill in your body. You have got a good behavioral change. You never thought when you are appointed something, you have to do all this making up your hospital and getting the wards into bed. So that is something good, because you have get some behavior change. And improve the self-esteem, and you have done it, and we have acknowledged that. Now, so lifelong learning is important for doctors, because the reason I told you, it's a very rapidly evolving field, evolving at an exponential range. And clinical studies 6 months before may not be valid today in a particular field. We saw in the sepsis talk given, right? And so you need to be abreast with the current literature by going through the lifelong learning. And otherwise you get outdated. So it allows clinicians to stay up to date improves clinical outcomes and remains successful careers. And more than that, if you use the most up-to-date method, you can even do cost cutting. Of course, we have not, health economic is not the part of Sri Lanka health system, right? But if you are really, as a government, if you are really concerned about cutting down, they should facilitate more lifelong learning, because that is one way that they can cut down healthcare costs. And after the ETUs, how many cost cutting has been done? Introduction of the emergency treatment units, if they have analyzed that, and the short stay wards, which is very difficult to get in the medical setting, and the daycare surgeries in the hospital. And we have in the teaching hospital Karapitiya, we have even a theatre, mini theatre in the OPD. It has cut down costs. So those are the things that you have to think about. Now there are attributes that you need to possess in order to empower your career. You will not get just unless you have attributes. Then now there are certain people have certain attributes. Now you know certain people now, like politicians, have certain attributes. They smile with each and everybody, and they will not fight for simpler successful politicians. And they will not say no to everybody, and they will say yes to everything. And you know, that is an attribute that to be a politician, you have to have that attribute. But to be a successful professional, you need to have some other attributes, not those. You need to have a curiosity, desire to seek new knowledge. I don't think politicians need to have that. Desire, they are not. So long as a desire to new waters, that is more important than new knowledge for them. Dedication, this is some important thing. As I said, it's a grit, the dedication. Come what may, I face this. Come what may, I reach this goal. It's a commitment. And also, when there's a information overload, when I first entered medical school, the first book I was given is a Grant's Method of Anatomy, this size. And I was really shocked to see, is this all within 5 terms? Come what may, Harper is double the size, Harper and the Gannon. But you need to know all that to get distinctions. But truth is that. But don't get disheartened by the lot of new information coming every day. New England Journal of Medicine is publishing at a rate weekly. But you need not bother to read all of that. I'll tell you how to manage them. Critical thinking skill, to carefully evaluate and apply updates in practice. Critical thinking, because just because the research comes, that does not mean that we need to follow them or implement them or believe them, or we can recheck them in our setting. They are done in a totally different setting. We can rehearse them. So that needs critical thinking. So these are the 3 attributes one need to have as a professional to succeed in your field. Now, answer the question, how can you bear up all this information overload? Luckily, these publications and publishers and the providers are commercialized. BMJ is a commercialized thing. And most of the other things, Elsevier is a commercialized. Now, even to publish an article, now you need to pay about ₹500,000 in one of those journals as a article processing fee. Even after going through all that. Very rarely that you can go through. Now that we have been downgraded, we may get something, but actually it's difficult. So because of that, they improve themselves. They know how best to give their information to the doctors. So other than the big journal in the printed format, now they have e-versions. Not only that, they have curated alerts. I'm not sure how many of you have got subscribed to this curated alert. So experts go through all the articles within the week, and if you select your field of interest, they will send you daily the alerts. So you don't have to read it then and there because it's in your email inbox. So when you are waiting for a bus or something like that, you can quickly go through your alerts. What you call ETOCs, table of contents. Of course, they give abstract. That's what we want. We don't want to go through the whole article unless you are interested in redoing the research here again. If so, you can retrieve it. So read, listen, and weave expert handpick commit. Now, if you go through the recent webinars, now webinars are now, even though it is 15 minutes, they also divided into 3-minute slots. And by the side, you get the what is highlighted within then 3 minutes. So if you are really a practicing physician, suppose you are going through a fatty liver webinar, but you are not worried about the fatty liver imaging and all that, you are bringing whether the practice has changed. So there is a small point, practice there. You don't have to go to a 15-minute webinar now. You can go to a final 2 minutes webinar slot and finish it. So they have done to that level. And if you are rich enough, you can subscribe, but there are so many free alerts. Like, this is what I get. Practice update I get daily. Cardiology and diabetes. It's daily from NEJM and Lancet. New England Journal Internal Medicine Journal Watch. You get weekly, right, in your field. American College of Physicians Journal Club, when I got the fellowship, and all of you have somehow, you will get the analysis of internal medicine. So analysis of internal medicine gives you every 2 weeks very good alerts. So lifelong learning, continuous professional development, continuous medical education, those two are the same I told you. And CPD is little different from lifelong learning. I have to be on the little fast here now. And CPD is the term used to describe activities that engage in the develop and enhance their abilities. Now, this slide is also worth staying at least half a minute. Now, I told you the different modes of mastering CPD is not by the formal education and training. You don't call this a formal education session. This is an informal. If you like, you can listen and go out and have a snack and go out. So it's informal. And we are not checking whether you are here always. We are not presenting marking your presence, right? So informal learning is what you all as professionals engage in getting the CPD much. And conference meeting, that is what we do, presentations, and only a person who has presented something know what sort of work goes through before the presentation. Only a person who has sent an article to a journal know how difficult it is to do. So those are things worth doing and getting that experience. And only a person who is in a committee will know how difficult it is to get things done. So that is something that also you have to master as a professional, getting yourself empowered. So you get empowered by postgrad qualifications, that's a formal. Accreditation as a government body, SLMC, UGC. I don't want to talk about SLMC because it has become only a money laundering. I don't think I will be sacked. So but you get this only to provide certificates of good standing and all that. Whatever the dirty things you have get, you can still get if you pay 5,000 rupees, bucks, next day. You can do the same thing from other quack medical practitioner. Also you can get, they only check whether you have registered. That's all they check. Overnight they produce. They are interested only in 5,000 bucks to sustain that elderly lot in the office. And professional organization and college relevant fields, SLCIM, CCP. And last, individual efforts and approaches. So you better look at the overseas models. Now overseas models, the UK professional, which we follow always by heart, we know it works in harmony with GMC and CPD in general. They hold postgraduate exams and award diplomas. And now they have already gone to accrediting, not giving a general diploma. They give different accreditation. You get a MRCP in diabetes endocrinology, in rheumatology, and all and so on and so forth. That is a better way. That is how they earn money. That is how they. So we need to think about those things. Fellowships are based on the RCPs on the merit. Just because you nominate, you won't necessarily get it. And they charge annual fee for their this thing. Not life membership fee. Because we need to maintain all this. Right. So these are the points to ponder in Sri Lanka. Qualifications, PG qualification degrees, we are not really awarding degrees for the national needs. If we are doing that, why are there conflicts between the colleges and all that? Why the clinical hematologists can't go to oncology unit to get their training? Because there's no national policy, right? There's a professional disharmony among the specialists. So who is at blame? I don't know. In my opinion, it is a PGIM. Awarding fellowships to the professional colleges, and we only take into account the number of years after your MD. I think now the College of Internal Medicine have not started awarding fellowship. We must think about not giving fellowship only for the number of years after MD or being a member here. It has to be based on some merit, right? Right. So this is what SLCIM has so far done. In peer learning for us, not just CME, is a novel concept. And skills development workshop like point of care ultrasounds, it's also giving our members, but we have not accredited. One of my colleagues, Professor Lekamasam, called me, somehow get it accredited. Otherwise, you can't claim that. Get it accredited by a college, our radiologist will not come accredited, but at least from someone else. SR Forum, in 5 years back, I don't think any SR would be given a chance to present other than the best presenter or somebody. But here we just saw what at a SR level Lakmal has done and presented. So it's empowering themselves from the word go. So the last slide is the individual efforts. So only 2 more slides. So empowerment with individual efforts, you must follow your intuition and passion. There's a difference between the intuition and passion, you know. There's a nice ad in the painting ad when it called desire and when it calls fashion. Not fashion, it's a passion. Passion in the sense of, again, passion can be 2 ways. Passionate or other passion. So this is, you need to have a desire to do this job, but you need to have a passion to get empowered. So passion has to be inculcated, cultivated, developed. Expect challenges. Of course, there are challenges. If you are not faced challenges, you have not done anything. Learn from the peers, but don't literally follow them. There's only one particular person. You can't be ideally that person, but learn from him where he has succeeded and failed, but don't follow. Explore new areas. There are plenty of new areas in this internal field, maternal field. And grow gradually. And overnight successes are often vulnerable. So don't try to be a big boss 3, 4, 5 years after board certification as internal medicine. It has to be a gradual process. And this is the last slide. I wanted to end with this quote. So I gathered it from Human Resource Management Journal, but it was written by a physician. The tide is changing, and I, for one, will continue to do all I can in my circles of influence, taking risks and fighting for what is right. My colleagues, it is almost too late, but yet it is not too late. Join me, stand up, speak up, enough is enough. Thank you.